Re-establishing professional values and the esteem back to medical practice in Nigeria was the crux of the message during the 2024 Annual General Meeting AGM and Scientific Conference of the Nigerian Medical Association NMA Asaba Zone held in Asaba. At the opening ceremony, the NMA chairman Asaba Zone, Dr. Christopher Tene, harped on the need for medical practitioners to uphold the ethics of the profession and imbibe modern technology to enable them function in line with global best practices. Dr. Tene, a consultant neurologist who frowned at the trend of medical brain drain in the country, called on government at all levels to intensify efforts in the area of security of lives and properties of citizens and improved remuneration for medical workers, bearing in mind the increasing harsh economic realities. He expressed satisfaction at the turnout of members at this year's AGM and urged stakeholders in the medical profession to re-examine the practice that flows with the tides of change.
We've talked about the medical ethics, re-establishing our medical profession, the ethics and what we're supposed to do, and how doctors' lives should be more of humanity or humanitarian service rather than chasing other things. The government should do more in terms of security to secure the lives of people working here.
The chairman of the Board of Internal Revenue Delta State, Honorable Solomon Irapata, who was also the chairman on the occasion, observed the peaceful disposition of the NMA Asaba Zone in the discharge of their duties. Honorable Irapata, represented by Chief Frank Nwugo, noted that the medical profession was all about service to humanity and appealed to the leadership of the NMA to look into the issue of medical brain drain.
Human life is the most valuable life to human being and to God. And because of the value of human beings to God, I want to use this opportunity to appeal to the NMA, which is the parent body of all medical associations in Nigeria, to look into the symptom of, what I call it, medical japa, what I call it, what again now, brain drain. Is a professional expert to Nigeria and to Nigerian people.
The Director General and Chief Executive Officer of the Delta State Contributory Health Commission, Dr. Isaac Aboveta, in a lecture titled Contributory Health Scheme, The Prospects and the Future, said health insurance brings about inclusivity in healthcare delivery and assurance of universal health coverage. Dr. Aboveta noted that Delta State had registered over 1.8 vulnerable persons into the health insurance scheme and made provisions for those in the hard-to-reach areas to receive care, including the riverine areas, adding that data from the federal government had shown that Delta State was number one in the country. He commended Governor Sheriff Oborowori for his efforts in achieving such feats, especially in footing the medical bills of vulnerable persons resident in the state, including the pregnant women and the 5 children and physically challenged persons, as well as the measures put in place to ensure equitable access to the subsidized rate of 7,000 naira premium for residents who fall under the informal plan.
What is contributory health scheme? And I explained to them it is about everybody contributing to a common pot, and from there we treat everyone. The poor we bring little amount of money, the rich we bring a higher amount of money. We mix it together and give everybody equal treatment.
There were also lectures from the keynote speaker and permanent secretary in the State Ministry of Environment, Dr. Minio Seji, and a representative of one of the fertility-assisted conception providers in Asaba, Nautical Fertility Center, who spoke on future trends assisted reproductive techniques.
If the profession does not enforce the ethics of the professional members, people outside will now come and enforce it, and that will diminish the profession. In that monopoly, there has to be government regulation. So, for you to become a medical doctor, MDCM, which is by law, the regulatory body to indicate the requirements for training and qualification and all that.
If fertility has DNA, sperm DNA damage, high DNA fragmentation has been found in men with normal semen parameters. So it's indicated to when people have an extended fertility, multiple failed, recurrent miscarriages, advanced maternal, and all those causes are said that could affect this.
The event had at its highlight the unveiling of the second edition of the NMA Asaba Zone newsletter.